All right. Hello, everyone. My name is Makia Algamdi. I'm an admissions and recruitment specialist for the Brown School within the Office of Admissions and Recruitment. I am very happy to see so many of you joining us today for the info session on transdisciplinary problem solving and public health. And if you would like, please feel free to introduce yourself in the chat box, tell us your name and where you're zooming in from today. So today's info session will be facilitated by Angela Hobson, who is a teaching professor and associate dean for public health. And before I pass it on to Angela, I would like to remind the audience members, if you have any questions during the session, please feel free to use the Q&A button that you can see at the bottom of your Zoom page, or it might be at the top. All it says is Q&A. You can select that button and then you can put in your question. That way it'll show us that you have a question to ask, and we'll make sure to keep track of it and try our best to get to it at the end of today's session. So now I'm actually going to pass it over to Angela to get the session started.
Great. Thank you so much, Makia. And just a question on logistics. Can anybody put anything in the chat? Is that how this is set up?
Yes.
Okay. Great. So, and while I'm talking and introducing myself and what we're going to do, I would love to know where people are joining us from. So thank you so much. First of all, thank you so much for joining us. And we've got an exciting panel lined up here, but we would love to know where you all are from. We are all in St. Louis, of course, but we'd love to know what part of the world or what part of the United States you're joining us from. So please feel free to put that in the chat if you'd like. So as Makia said, my name is Angela Hobson. I use she, her pronouns. I'm a teaching professor here at the Brown School, and I also have the honor of serving as the Associate Dean for Public Health. And our agenda for today is that we're going to have a panel of faculty who are going to introduce themselves and talk a little bit about the transdisciplinary problem solving courses that they teach. And then I'm going to give a little bit more context about what we really actually mean by transdisciplinary problem solving and why we think that's so important here. And then I'll take my slides down and we'll have kind of a conversation about these classes and research and all kinds of interesting things that you may want to know about us. So with that, I'm going to turn it over to our first panelist, Molly Pearson.
Thanks, Angela. So my name is Molly. She or any pronoun is fine with me. And I teach harm reduction community practice, which I'm actually really excited. We are piloting for the first time this semester. And it's been a really, really special opportunity to develop this class and put it out there. So in this class, we explore the historical context and origins of harm reduction and why this context is essential in order to understand the growth and evolution of the harm reduction movement. It really started as an underground kind of clandestine operation from people who were deeply, deeply impacted by HIV and the war on drugs. And now, as we speak, it's being professionalized. It's being accepted as a legitimate intervention and political movement. And so what does that tension really mean? And so we take a deep dive into the history and origins and the evolution. We also, throughout the semester, identify important personal and professional ethical considerations when applying harm reduction principles. And this is a transdisciplinary course. So we have social workers and public health students in the room. And so really taking a look at those practice implications through the lens of ethics. We also examine the viability of harm reduction within a political climate that is conducing to ending or reducing incarceration and policing. Our paradigm is shifting when it comes to punitive measures, particularly punitive measures in relation to public health strategy. And so looking at the opportunities to expand harm reduction as our approach to policing and incarceration is changing.
Great. Thank you so much, Molly. Our next panelist is Lindsay Stark. So Lindsay, I'll pass it to you.
Thanks so much, Angela, and welcome everyone. It's wonderful to have you all here. I'm Lindsay Stark. I am a professor of public health and social work and also serve as the Associate Dean of Global Programs here at the Brown School. and co-direct a center on violence and injury prevention within the Brown School. So my own field of practice and research is generally in the area of humanitarian response, conflict, natural disaster, complex emergencies. And the TPS course that I will be talking a little bit about today is the protection of women and children in humanitarian response. And for those of you who aren't aware, conflict, climate change, drought, and other natural disasters have resulted in the highest levels of displacement ever recorded. And so we are just dealing with vast numbers of individuals who have been affected, displaced, and whose lives have been uprooted in some way. And so this course is really devoted to developing a practical understanding of the issues, the risks, the protective factors that particularly women and children in these circumstances are facing, and developing a practical understanding of the evidence out there around effective programs and response, as well as the systems that are often erected in this space, and sort of a critical analysis of what those systems look like within humanitarian response and how we hopefully are evolving to a better place. I will leave it there for now, but happy to come back to that as we move forward.
Great. Thank you so much, Lindsay. And our next panelist is Jessica Levy.
Hey everyone, great to be here. My name is Jessica Levy. I'm an associate professor of practice, which means that a lot of the work I bring to WashU is practice related rather than research. And so I try to bring that experience into my classroom and certainly into my TPS courses. And likewise, I try to use examples and case studies from that experience to teach students about real world issues and situations. So I teach 2 TPS courses. I teach a class called Global Reproductive Health, which I teach in the fall, and then Gender, Poverty, and Global Health in the spring. Both classes are very globally focused. I'm also the chair of the Global Health Specialization. And in the first class, Global Reproductive Health, as you may all have heard or know, we have a lot of changing landscapes now in reproductive health, not just in the United States in terms of abortion and access to contraception, et cetera, but all over the world and in all regions of the world. So in my Global Reproductive Health class, we really take a cells to society approach. So we go from thinking about the biology behind reproductive health and how understand what is going on, to then the societal factors and the inequities and political factors that are more upstream, but that certainly have influence over what is going on, both individually, but also nationally and globally. And then in my Gender, Poverty, and Global Health, I apply a gender lens to health and development programming, policies, and evaluation. So I ask my students to really think about how the idea of a gender system or the idea of how we or one's culture, one's context define masculinity and femininity, and how those boxes tend to be really harmful for individuals and communities. And we apply that lens to different sectors, whether they be reproductive health or water, sanitation, and hygiene. And it's a great TPS course because we get to bring in a lot of different sectors there. So I'm sure we'll talk more, but that's a brief overview of what I teach.
Great. Thank you so much, Jessica. And our final panelist, who is just joining us, and whenever we say on these slides, recently taught courses, we really mean that, because I believe Jessica and Matt are just coming from their TPS courses. So our next panelist is Matt Kruder, who will talk about a little bit about his course and himself. Matt, I'll turn it over to you.
Thanks, Angela. Hi, everybody. Indeed, just arriving back at my office after teaching the Eliminating Health Disparities TPS course. Here's where I would start. And I think in my course, we've really tried to emphasize the T in TPS. We get stuck in public health, but I think in a lot of other places too, we get stuck with old ways of thinking. And our ideas about what factors cause disease and health problems and what solutions to try to address those get stuck. They get stuck in old ways of thinking. And to get unstuck, we think that we being really the, sort of the Brown School approach, we think that you've got to examine a problem from not just different perspectives, but new perspectives and other ways and models of thinking, other ways of knowing, to try to understand potentially, new ways and new insights about what are the factors that lead to health inequalities. And then more important and frankly, more interesting to the students, to also begin thinking about better solutions. New, different, refined solutions that gain insight, not just from our old public health ways of thinking, but from how other people understand the world. And not just other university experts, but people who work in these fields in practice agencies and organizations. And so, that's kind of more of a philosophical description, I guess, of what happens in this course. Practically speaking, one of the things that we do is try to arrange our students every single class period in a group of folks who have different experiences and backgrounds from them, different work experience, different disciplinary training in their undergraduate or graduate studies. And then there are always multiple opportunities in class where those groups, those new groups each week, are asked to think about and try to solve problems from these new perspectives. And so I think the course tries to develop that muscle and that skill set with the particular challenge of addressing, the really profound health inequalities that exist between different groups in society. So that's probably longer than I should have gone, but hopefully that is helpful. Thanks, Angela.
Yeah, thank you, Matt. And I think that tees us up well for these next couple of slides, and then also for the questions that I'll ask here in just a minute. And maybe it would have been helpful to have this context before our faculty talked about some of their courses, but I'll talk just a little bit more about what we mean by transdisciplinarity. And I wish I was as clever as my colleagues in coming up with good cartoons to put in slideshows, but I've got to give credit. I think this was Deborah Hare-Josh who had this in a slide deck, and I thought, oh, that's clever. I'm going to use that. But this cartoon here, as you can see, is a pack of wolves that are howling at the moon. And the question underneath in the caption is, my question is, are we making an impact, right? And so that's what we're really getting at here in public health. That's what we want to do. Our aim is to make an impact, to improve lives and improve health outcomes in the communities in which we serve, right? But sometimes we don't want to just be howling at the moon, wasting our time trying to make that impact. And we know that even if we're classically trained in public health and public health methods, that's not enough, right? It's not enough to address some of society's what we call most wicked problems, right? So those big health disparities between groups in society, or addressing global reproductive health, or humanitarian response, or harm reduction, like our panelists have talked about. So these problems really benefit from thinking about those new ways, thinking about the problems in new ways, as Dr. Kruder said, and thinking about new solutions. And when we kind of define that, we want to put some definitions around that. Transdisciplinary science, we can define that as a field of research that focuses on distinctive substantive concerns. So those big, wicked public health problems, right? And emphasizes particular analytical levels, theoretical concepts, and methods. So that's kind of an academic concept there, right? But when we're really thinking about it, when we think about transdisciplinary problem solving, we're really thinking about these shared conceptual frameworks and new models and new approaches to addressing problems. And I think this graphic does a good job of depicting that. In the first, on the top half, we can see kind of a multi or interdisciplinary approach where we have these three different disciplines that kind of are overlapping at the margins in their Venn diagram, thinking about defining a problem and their shared methods. But when we think about transdisciplinary and how that really differs, as we see there's much more overlap. There's a new conceptual framework, that there's a definition of the problem together between those three different disciplines, and then there's shared methods and policy solutions to that problem. So that's what we're really talking about when we think about transdisciplinary. It's not just interdisciplinary where we're kind of working at the margins with each other, but it's really thinking about new ways to address big problems. And this has really been kind of a hallmark of our program since its inception in 2009. We really want our students to be thinking in this way and to get a lot of exposure to other disciplines and understanding how we can work with them to improve public health, both locally and globally. And so each of our students take 2 transdisciplinary problem solving courses. We have a host of them every semester, and you've heard a little bit about these. I'm going to actually stop sharing my screen so you can see our squares a little bit more, and I'm going to ask our panelists a few more questions about their courses. And my first question, I think you all did a really great job of describing your courses, but my first question is, how specifically do students learn from different disciplines within your course? And I'll throw that out there and anybody can jump in and answer that one first. Go ahead, Matt.
I can jump in, Angela. So we have both a component of the class as well as an assignment for students that we call discipline of the day. And so we will, as instructors, present a discipline that people may not typically connect with public health. So it could be demography, it could be marketing, it could be something biological, and we will illustrate, with, sort of a case example, what are the insights that discipline brings to solving public health problems, and then, sort of ask and challenge the students to think about, how might this inform the way we think about and address different problems. And then students also this is one of their assignments. They have to actually, research and present a discipline of the day and link it to, in our class, public health and health disparities, both in terms of understanding it and solving it. And then there's a new assignment this year that we've done that's pretty interesting. We also require all students to have like a pretty deep engagement with someone from a non-public health discipline, to try to learn about that discipline and then write about how they would apply that to public health. So there are a couple of both assignments and components of every class period.
Great, thank you.
I can jump in. So we approach the overarching topic of harm reduction through multiple lenses. So we look at grassroots community activism, but we also look at medicine and pharmacology. One of our core texts is by a pretty radical activist. And then another one of our core texts is by a global expert in pharmacology. And so we really hold those side by side and say, what are the overlaps? Where are points of collaboration here? Because it doesn't have to be pitted against each other. There's opportunity to create new solutions in partnership and in coalition. And we also bring a lot of those lenses into our assignments also. So for example, one of our assignments is to actually attend a naloxone training that is, you get a naloxone training in the first hour, and then the second hour is a training on how to stop bleeding from a gunshot wound. So that's taking like a really unique kind of both biological medicinal intervention and also thinking about community mental health and community physical health and the trauma that comes from both overdose crisis and the crisis of gun violence, and talking about those in tandem and what they have to do with each other, and how we can be stronger when we think across those big problems here in St. Louis. And that training is administered by a medical physician. So there are like a lot of layers there to unpack. And so that's just one specific example.
Great, thank you.
Angela, are you wanting each of us to talk, or were you?
Yes, that'd be great.
Lindsay, did you want to go next?
I can, or you can, either way. All right, I'll jump in. So, within my class, we do a bit of a critical analysis of the drivers of humanitarian disasters and catastrophe, many of which are man-made, many of which involve climate, disaster change, as well as an analysis of the humanitarian system, which brings in everybody from engineers to psychologists to social workers to public health practitioners to lawyers who are working at various levels of the system. So I do bring in a number of guest speakers from different disciplines who are able to bring both their disciplinary perspective, but then also speak to how their discipline and practice informs and touches on other aspects of the main issues that the course deals with around protection of women and children. So, for example, it may not be intuitive to think about how an engineer who's going to a humanitarian crisis to set up a water and sanitation system actually needs to understand the way that they're setting up the system in a way that doesn't endanger women and girls who need to access water safely or latrines safely. Or food distribution and how that can actually impact the safety and well-being of individuals. So, I think it is a bit of recognizing the many disciplines that are involved in this work, how the work touches on and relates to one another in ways that we don't always do well enough in terms of taking into account.
Oh, that's great. Thank you, Lindsay.
Yeah, and I'll just add, because a lot of similarly to what Lindsay was saying in terms of the critical analysis of what the pathways that lead to a lot of the outcomes we're talking about certainly is we have to look at different disciplines and different reasons outside of public health for that. But I'll just add to that by saying that in both of my classes, in addition to bringing in a lot of guest lecturers from all over the world, actually, in some ways, COVID has made that easier, in that now we are more open to the idea of Zoom, so we get to bring people in. And so not only are you getting lenses from different disciplines, but different kind of global contexts and experiences, but also this idea that as a big part of public health, we're constantly asking our students to think about the pathways that lead to our outcomes and think really upstream. So when we're thinking about reproductive health, for example, not only am I asking physicians and medical people to come in to be thinking about these more proximate determinants or determinants that are very close to the outcomes that we're looking at, but also I'm asking, policymakers to come into the class. I'm talking to my students about how economics and the economy can influence reproductive health outcomes, how racial dynamics can influence, how certainly education influences. So, without bringing in these different lenses and these different disciplines, you wouldn't have a full picture. Likewise, when we're talking about gender and global health, I think of, and I teach gender as a system. So we're talking about gender norms and inequalities, and you can't talk about norms without talking about all that come with norms and how they are affected and et cetera. So again, we literally do what we call is a gender analysis, and we go through thinking about who has access and power over resources, what are the laws that exist and how are those laws discriminatory, who has education, et cetera. So it's so key to these topics that to not do it would be a real disservice to be thinking about then moving into the next section, which is how do we begin to solve these problems?
Great. Yeah, thank you. Yeah, I think that's a great overview of how you all incorporate different disciplines. And Matt touched on this, so I'll ask the rest of the panelists. Matt talked about the assessments, the discipline of the day, and then working really closely with another discipline. How do you, the rest of you, how do you incorporate assessments? Is it, are there papers? Are there, evaluation projects that students are doing? How are they assessed in the course to understand if they are really picking up on those key pieces of the transdisciplinarity and how other disciplines work with us and we work with them?
Yeah, I mean, I can go first here. In the global reproductive health class, I actually have assignments that are, Matt, I'm really impressed that you discipline of the day. I do more like discipline of the assignment. I will, I, for example, will have one assignment is just all about a communication plan and how do we, reproductive health is a really controversial, difficult topic. And how do we begin to communicate in a way that is more inclusive and educational and certainly translates to change. Likewise, and I also have them do assignments around policy, et cetera. Likewise, in my gender, poverty, and global health, like I said, we do just to say too, in the global reproductive health, the first assignment is literally to do a causal framework. And for those of you who don't know what that is, I have students map out the pathways all the way from some of these social determinants like education and the structural and institutional factors that we're talking about that come from that have different disciplines in mind to these very upstream, far-reaching things all the way down to the outcome of the student's choice. So whether that be maternal mortality or contraceptive use, et cetera. And then in the gender, poverty, and global health, we do this gender analysis where they choose a country and use data from that country and not just necessarily hard data. It could also be data from looking at their laws and their policies and their media, et cetera, to really have an understanding of what are the norms in that country. And then based on those norms, they come up with a plan to integrate what they've learned into a program plan that is related to a certain development outcome. So it's interwoven into every assignment that we do.
Great, thank you. Molly or Lindsay?
Yeah, so I know I already mentioned the assignment to actually attend a naloxone and stop the bleed training. So that's one. But a written assignment that I'm really excited about this semester is a really intensive interdisciplinary deep dive project. So it starts with a literature review, assessing literature from a variety of disciplines. So medicine, communications, art, and aesthetics, because how we communicate health information to communities matters. Particularly with a topic like harm reduction and substance abuse, it's really important to cultivate trust. So how are we getting information to communities? Mental health. So this wide sweep of a literature review that is transdisciplinary, and then taking what we learned from that literature and then looking at a case study where students get to choose a real world harm reduction effort, whether it's a grassroots effort, whether it's through a public health department at the state level, whether it's a policy at the federal level, and taking what they learn from the literature and then comparing it to what's actually happening in the real world. Where are the gaps? Where are the commonalities? What additional research is needed based on what our practice is telling us, and based on what people who are doing the work are telling us. And the reverse, what practice implications are there from the research? So looking at that bi-directional relationship between sort of the academy, but then also people doing it in real life, but through a transdisciplinary lens. So I'm really excited to grade that assignment. I've never done it before because this is the first time we're offering this class. So, but based on conversations with students, I think they're really excited about it, because I think bringing in the element of choice, like Jessica was talking about, we're talking, with a transdisciplinary lens and approach. There's so many different ways to plug into one issue. And so giving students the choice and how they focus and shape that assignment, I think increases excitement to do it.
Yeah, that's great. And just speaking of the excitement, and Molly has mentioned this a couple of times, this is the first semester we've offered this course, and it was just wildly popular for both social work and public health students, where we had, quite the conversations on figuring out wait lists and who was going to be in the course and who was going to have to wait to take it. So everyone is really excited about that course, and just think, you're doing such a wonderful job. It was a, much needed piece of curriculum for both programs. And so, we're just really excited to see the student outcomes from there.
So I'll just share one of the assignments for my course, which allows students to work in small groups on an issue of their choice that's not being covered in depth already in the class. And so some of the examples that the groups have selected, the topics that the groups have selected this year include non-formal education in emergencies, LGBTQ plus populations in emergencies, disability programming in emergencies, and child marriage. And so they are expected to go out and do independent research across, a number of different sources and from a number of different disciplines on their topics, which are in and of themselves interdisciplinary and transdisciplinary. They're encouraged to actually interview experts in the field who may have additional resources and insights that they are able to provide. And then they're responsible for doing a few things. They're responsible for leading a course session with their peers, where they actually are the instructors and give a brief lecture and create some sort of in-class exercise for the students to engage with the topic and the material that they have taught. And then they're also asked to write a short policy brief or call to action. And there they are identifying the audience that they're trying to compel to action, and using the evidence that they have distilled across a number of disciplinary perspectives to try to sway or promote change. And I fully hope and expect to be able to actually share some of these products with practitioners in the field, and I'm very excited to do so.
Wow, that's great. Makes me want to go back to school and take all these courses.
Angela, do I get to respond again, or was
Yeah, please, yeah.
limited?
No.
I want to pick up on what Jessica said, because I think it's really important, and I want people who are listening to understand it. So Jessica, you talked a lot about understanding, getting the students in your class to understand pathways and mechanisms and causal frameworks, that explain how we get from an exposure to some outcome in public health. That is so important. First of all, it's a competency for these TPS courses, so we need to be doing it well. But here's why it matters, because the way, and this is unequivocal in the history of public health, the way you understand causality, the way you understand the factors that lead to an outcome, defines how you address it and solve it. So if you have a very narrow conception of what causes a certain outcome, then you're going to consistently intervene based on that model. You got to broaden the view of what could be influencing this. So in our class, on the very first day of class, before we've done anything, students in their teams they've got to develop a causal framework for health disparities. And then what they don't know at the time, I shouldn't be giving this away, you might take the class, but at the end of the class, we come back to the exact models that they made, which we kept. And we ask them to critique, like, what did you get right? What did you get wrong? What did you leave out? What associations, where did you think an association was X when it really was Y? And I think it's a useful learning experience for students to sort of see, sort of the growth and how, almost always, sort of kind of an expanded perspective leads to a really different conception of how we might work to address disparities.
That's really great. I love that piece. It's more of like a self or group reflection on what they've learned. I think that's wonderful. And then Matt, in the class, and like you explained earlier, health disparities, I mean, that could really cover a lot of things. So are students choosing whether they're working on a racial health disparity, a gender-based health disparity, geographical health disparities in rural versus urban, or low-income countries versus high-income countries? How does that play into the course?
Yeah, so there's a lot of student latitude to, sort of pursue things that you're interested in and passionate about, but also things that you want to learn more about. Like, actually, my advice to students would be, don't just do things that you're already really familiar with. I mean, that's good in some cases, and if that's what you want to do, but sometimes you learn a lot from, thinking about something you haven't considered a lot before. But the short answer is yes, Angela, there are not limitations on what defines a disparity.
Great. And then I know we have some student pre-submitted questions, but I want to ask one more question here. And Matt, I think I want to start with you again, just because Matt is actually one of our founding members of our public health program here at the Brown School. And I just wonder if you can talk about the vision for transdisciplinary problem solving at the Brown School, and how you think we may do this differently or even better than other schools or programs in public health.
By founding, what you really mean is old, I think, right? That's code word for the oldest here.
Yeah, it means you're a well-respected leader.
Perfect. So I think one of the visions that we had when we sort of hatched this focus, by the way, I mean, a lot of credit to the faculty here. Transdisciplinary thinking in public health is now pretty ubiquitous. Like you'll find this almost any, legitimate, quality program that you find. But honestly, we were doing it before anybody. And so I give a lot of credit to our faculty and leadership for recognizing that this was the future. Like public health was only going to advance if we could get, a bigger, broader tent contributing to this. I think our vision for these TPS courses was that ultimately they would be populated not just by students who are going to learn about other disciplines, but they would be populated by students from other disciplines. And so that you would have in a classroom, you would have public health students and social work students and engineers, and you'd have, business people. I'd give us kind of a, maybe a B grade on the extent to which we've done that so far, mostly because it's hard administratively within the university to do it. But I think what you've heard from some of the instructors here is one way around that is you bring in instructors who have these other perspectives, from different disciplines. And I think that's a great step in the right direction. So I do think the future is more really kind of cross-disciplinary learning. And I also want to say this, discipline is such an academic term, and I think to most people it means like, oh, well, okay, so English is a discipline and psychology is a discipline. I don't think that's the way we think of it here. So in public health practice, there are also all sorts of sectors that may not be academic disciplines, but they have insights, and they definitely have, certain ways of seeing and understanding the world, and we want to draw on those. As well. So I think the future is an even more highly integrated experience across all, when you're bringing together people with lots of different backgrounds.
Great. Yeah, thank you. And Jessica, Molly, or Lindsay, I don't know if you want to add anything, or if you
Yeah.
could add anything about
I
how you
can-
view this. Yeah.
Yeah, sorry. I can chime in, especially because I have to leave in a couple minutes to go
Okay.
teach my TPS course,
Yeah.
actually.
We're serious about these courses.
Yes. I think it's really exciting that in both the Brown School strategic plan and the university-wide strategic plan, there is a prioritization and uplifting of transdisciplinary collaboration across all of the university. And so that means there's really great energy between all the schools. And so I can bring in, a guest speaker from African American Studies and Arts and Sciences. And there's excitement and cohesion across the university. And both the Brown School strategic plan and the university strategic plan is also prioritizing community connections. And so it just feels really good to be teaching a TPS course with that kind of happening in the background, that the TPS approach isn't just in the classroom, it's really a culture that's developing across the institution. And so that just feels really exciting to be a part of.
Yeah, that's great. Thank you, Molly.
I'll just add briefly, Matt sort of talked about transdisciplinary science being a bit ubiquitous at this point. And in some ways, I think that's true in terms of recognizing that these real world problems that we're all contending with are so complex, and a single discipline alone is not going to solve them. But I have to say, I came to WashU close to 5 years ago now from another reputable school of public health. And I don't think that school was as intentional in terms of really how do we teach in a transdisciplinary way, and sort of bake these into the courses and the curriculum as we do here at the Brown School. So personally, I've been quite impressed at the way that's been done and being done here.
Great, thank you.
I mean, I could just add, there's not much to add. I would just say that one thing to be thinking about again is when we're thinking about problem solving, I think that the academy and the world are really moving more and more towards these kind of anti-colonial participatory approaches, where we really are involving, the expertise and the experience of community members and of leaders, different stakeholders and just that it's almost I find this shift and I appreciate what Lindsay is saying, that not everyone is necessarily doing it intentionally, but it's almost a shift in paradigm and how we're thinking about not just teaching, but the problem solving, and to think in silos and to think that we have the expertise, i.e. public health practitioners, is a real disservice to the problem solving. So it's a shift in thinking about who has the expertise and the humility around that, I think, as well.
Great, thank you.
I do have to hop off. I'm just going to
Yes.
say thank you. It's great to be here. Talk to you all soon.
Thank you so much, Molly. Really appreciate it. Okay, I know that we do have some pre-submitted questions that we want to get to, and I don't see any questions in the Q&A about the TPS, but I wanted to just take a minute and ask our panelists if they have any one last thought that they want to share with students about the courses or the Brown School, and then we'll turn over to the pre-submitted questions that students have asked. Any words of wisdom or advice as students are thinking about their trajectory and where they may land in the fall?
I'll just add very quickly that, the focus of this conversation has been on coursework, but I would say in terms of research assistantships and practicum opportunities, I think we have a lot of wonderful other ways to be engaged in transdisciplinary work within the Brown School.
Thank you. Matt or Jessica?
Let's go to the questions.
Okay, let's go to the questions. So Makia, how would you like to address the pre-submitted questions? You just want to go through them kind of one by one?
Yeah, that sounds great. And I'm going to answer a few too. So the first question actually is, what are ways WashU helps solve healthcare problems in my country, Kenya, and globally? How WashU students contribute to the goals of the McDonald Scholarship Academy. So I can answer this a little bit. So the McDonald Academy is a community at WashU that is committed to building a network of global leaders whose education and research pursuits span numerous disciplines. And this is pretty much very reflective of the transdisciplinary efforts that is put forth by the Brown School and faculty. So that's just a quick answer for that question. The next question is for our panelists. So the question is, what public health approaches are needed in low-income countries?
I'm going to look to Jessica and or Lindsay for that one.
I mean, I'm happy to start, Jessica, but dive in. The issues that I work on, violence, intimate partner violence, gender-based violence, exploitation, abuse. I would say that we have not cracked the code on this in terms of what we're doing in high-income countries, middle-income countries, or low-income countries, and so. In general, I think in terms of those areas in particular, we continue to need the very basic descriptive epidemiology on what's actually happening, who's being affected. We need better instruments around measurement and conceptualizing these issues and thinking about how to do these in different contexts on very sensitive subjects. We need better public health systems for response and intervention. So it's really the gamut, I would say, but I would say that, we have these problems and they are ongoing in the US and Europe and many other parts of the world as well.
Yeah, when you first said that question, I thought, oh my gosh, I don't even know where to begin. And I think that, Lindsay, just to piggyback on what you're saying, potentially a spin on this would be, rather than what public health approaches are needed, potentially how do we do our public health approaches? And I think, again, just kind of getting back to our conversation before about transdisciplinary, I think that it's really important as we're working in any part of the world to be thinking about these different pathways and how, it's not just, if we just think about health as this silo, we are missing opportunities to improve access, and we're missing opportunities to improve quality of care, and et cetera, et cetera. So, whether it's thinking about norms or education or infrastructure or religious freedom, whatever it is, if we as public health practitioners aren't taking those things into consideration, not only will we not reach our health goals, but we could do serious harm. And so I think that's something to be taken into consideration. And the other thing I'll just say here is, public health historically was very top down, and there's been a lot of harm as a result of that. And I think that when this question of what public health approaches are needed in low-income countries, again, I would argue the approach itself needs to include the bottom up. It needs to include people, from the different communities, really having a say in what is needed and what needs to be done. And also just to say that, low-income countries is throwing a lot of different contexts into one bucket. And so being aware of the different contexts and the different needs is also really important.
most of my work, all of my work really is domestic, but I want to take kind of a different spin on this question to pick up on where Jessica just ended. And that is that in public health, I think historically we've done a really poor job of sort of identifying organic solutions that emerge from people who are directly affected. And a lot of times people are actually quite good at solving problems that face them, but we don't do a good job of finding those and sort of identifying them and sharing them and spreading them where they have particular promise. And so I think that that's another area where not just developing countries, but everyone involved in public health would benefit from some sort of a public inventory, if you will, of innovative solutions. Some of the most interesting and my personal favorite examples are things we share in class that came from the last place you would expect innovation to happen.
Thank you.
Thank you all for your answers. So the next question is also related to admissions, and I can really quickly answer that. The question is, I would like to find out about the funding options available for international students who are financially challenged. So this is a great question, and we actually have an info session coming up next month that's completely dedicated to international students. The session is going to be March 1st, and I highly encourage everyone in today's session to also register for that session coming up. And we will be addressing all the funding questions at that time. And then the next question is also admissions related. The question asks whether applicants without a human biology background still have a fair chance of being selected. And the answer is yes. Although we do prefer you have that human biology background, we totally understand that not everyone has that. And so what happens is students who do not meet the human biology prerequisite when they're admitted are able to complete that, or they're required to fulfill that requirement by the end of their first semester. And we do have a list of pre-approved courses on our website. And if you have any questions related to the human biology prerequisite, please feel free to reach out to our office. Our email is brownadmissions@wusel.edu. And then the next question can go to our panelist or to our facilitator. And the question is, what are the career opportunities after the program completion?
Yeah, that is a terrific question. And we have really great success with our students going on to find employment very soon after graduation and or other educational programs. So we have quite a few students every year who go on to a further degree program, whether that be a PhD or sometimes an MD. And we have quite a few students who will stay in research. So they are hired either here at WashU and doing research work or at other universities doing academic research. And then we have the last bucket, I would say, is students who are going into public health practice, whether that's here locally in St. Louis, in the United States or globally. And Jessica and Lindsay and Matt too, if you know some recent grads and where they have been placed, that's great. But yeah, I think that the career opportunities are expansive in public health. And we have students that go on to be data analysts or epidemiologists in local public health practice or in academic research. We have students who go on to be program managers doing public health programming within local health departments or within local nonprofit organizations. Same thing for international nonprofit organizations. We have a lot of students who will work with them. We also have a number of students who will go on to do fellowships with the Centers for Disease Control and Prevention or other national governmental type fellowships. So, I mean, it really is quite expansive, and there's opportunities, there's all kinds of opportunities in public health employment that really is dependent on where you want to land. If you're wanting to do governmental public health, if you want to do nonprofit or NGO work, if you want to stay in academic research, there is just, a wide variety of places where places go.
Thank you for that answer, Angela. The last pre-submitted question is, how is the aging problem solved by the transdisciplinary method?
Yeah, so that's a good question. And I don't know that any one of us on here are content experts in aging societies, but we do know that aging society is, it's a contemporary public health issue with aging societies all over the globe. We don't have a TPS course specifically on aging societies or older adults, but we do have colleagues here in social work who are experts in gerontology and in on aging and aging populations. And we have a couple of courses that our public health students can take. There's electives in public health, and one is called Contemporary Perspectives on Aging, and the other is Social Policies, Services, and Programs in Aging. And in those courses, they cover all kinds of issues around employment, housing, transportation, finance, healthcare, and healthcare access that are really important factors for aging populations, and bring in a lot of different perspectives from other fields on those as well. So, I appreciate the question, because it is an issue that is a public health issue for sure. And we do have some opportunity for students to be involved and to learn from that work from our colleagues.
Thank you for that answer. So it looks like we have 1 minute left. So I am going to real quickly share my screen just with some information that the attendees will find helpful.
And while you're doing that, Makia, I just want to say I appreciate all the chat activity and learning where everyone's from. We have quite a few students joining from Africa, Uganda, Nigeria, Kenya, Ethiopia, Cameroon. So welcome, everybody. We have a few people from Texas. What else did I see in here? Ghana, somebody from Indiana, from India. Right, so welcome from Pakistan, Tampa, Florida. So really, I think what you're seeing in the chat is what you see here at our program. Students from all over the world that are coming together to learn and practice in public health.
Yeah, and I really am loving seeing all the international students in this session. So please make sure you register for the March 1st info session for international students. And then on the screen right here, if you want to reach out or learn more about the Brown School, the programs, if you have questions about your application, the program requirements, please feel free to reach out to us at brownadmissions@wustl.edu. And if you want to schedule a virtual visit or even an in-person visit that we are accepting on Fridays, feel free to go directly to our website. You can fill out a contact form or request form, and then you can select who you can meet with, and we would be more than happy to help you with that. And then I just wanted to say real quickly, thank you everyone for attending today's session. I'm so sorry we weren't able to answer all the questions that were submitted. I'm seeing them and I'm hoping to answer them. But I just want to say thank you so much for our panelists, Lindsay, Matt, Jessica, and Molly, and of course, our facilitator, Angela Hobson. Thank you all so much for being a part of today's session. And then again, for our attendees, if you have any questions, please reach out to brownadmissions@wustl.edu. And just a final thank you to everyone. And I hope you all enjoy the rest of your day.